Today I'm going to talk about competition ratios for specialty training at ST1 CT1 level. You may be aware that over the last few years, all specialties have seen significant increases in the number of applicants and therefore the competition ratio, because job numbers have only increased marginally. If we look at the 2025 data, which was recently published, what are the top 10 most competitive specialties in terms of applications per post? Let's go through them. At number 10, we have Anesthetic CT1, 12.56 is the ratio. Next, ACCS Emergency Medicine, 14.23. After that, Obstetrics and Gynecology, 16.65. Then we have Ophthalmology, just over 21. Core Psychiatry, over 21, 21.83. It's now more competitive than Ophthalmology, Obstetrics, ACCS, Radiology, Core Surgical Training, whereas going back just 4 or 5 years ago, it was one of the least competitive specialties. Neurosurgery, 26.71. However, bear in mind there were only 21 jobs. Similarly, Public Health Medicine, 28.53, only 95 jobs. Cardiothoracic Surgery ST1, 73.7 applicants per post, with only 10 jobs. Community Sexual and Reproductive Health, 98.5 applicants per post, only 14 posts. And the most competitive specialty of all, Dual CCT, General Practice and Public Health Medicine. 167 applicants per post. There were only 13 posts mined. Some of the other really popular specialties, the numbers of jobs have increased slightly, but it's still really competitive. For example, Radiology, 11.27 applicants per post. Core Surgical Training, just over 8.5 applicants per post. The key thing to say, every specialty is now really, really competitive. So start early with your preparation. For those specialties where, part portfolio, part interview, you need to really make a start and try to work for every point that you can. For those specialties where MSRA is used either as the whole rank, like GP and psychiatry, or used to determine who's going to get an interview slot, start your preparation early, give time to both the clinical and the SJT paper. If you want help and support with any aspect of the application process, do get in touch. Ultimately, prepare and you will succeed.